for fungi. Oh, thank you that we remember that today. Thank God for fungi and Loretta and Sister Sarah gone. They were the one that made this happen. I just happened to sort of flow along with them. So I'm glad they were able to share the space and create this beautiful space for us to continue to engage ourselves. So, Sarah, are you able to introduce our speaker?
Hello.
Am
I okay? Yes, sure. I don't know. Am I audible now?
You are.
Yeah.
Can you hear me?
Yes.
Can I go ahead?
Yes.
Please.
Okay. All right. Thank you. Good evening, everyone. Good morning from across the channels. Thank you guys for coming in and joining our forum. Thank you, Moshood, for the introduction that you've done for us and also leading us in preparing for this great event that we have. And we are so grateful for all those who have responded to our call from the diaspora and those who are across the Africa. We really appreciate your presence. So here I'm going to introduce our first speaker from Zimbabwe. She goes by the name Pamela Marisa. She's the current Zimbabwe Psychological Association president. She is a registered community psychologist, and she's also the operations director for Transform Team Zimbabwe, an organization that offers emotional wellness services to corporates across the Zimbabwean community. So without much ado, I'm going to call upon Pamela to come in and make a brief presentation, which is a goodwill message for this whole program. So we really appreciate your presence, and we are now giving you the floor to deliver a goodwill message for this forum. So, Sister Pamela, please, can you please take the floor? It's over to you now. Thank you.
Thank you so much, Fungai. Good morning, good evening, good afternoon, everyone. And let me take the chance also to greet you in our one of our local languages in Zimbabwe. It's Mangwanani, Maskati, Makadi. Like, how are you? I'm very excited to be here. And, I just want to say also on behalf of the Zimbabwe Psychological Association, thank you so much to the SCRA leadership, Dr. Moshood and your team, for organizing such a great forum and for this great initiative. And as Zimbabwe Psychological Association, we're very happy to be part of this great initiative. So yesterday I had the opportunity to listen to most of the speakers that spoke yesterday. And what I found interesting is that our problems here in Africa, are so similar. They cut across, the borders. So that was very interesting. The issue of drug and substance abuse, the unemployment, the poverty, so similar. So here in Africa, one of our problems is power cuts. So I'm just going to remove my video because my connectivity is a bit poor. And then I just want to sort of like maybe just summarize and share with you maybe some of our most pressing needs here in Zimbabwe, just speaking from Zimbabwe. And I'm so glad that we have different stakeholders on the platform. So for us in Zimbabwe, one of our most pressing needs, there's the issue of drought as a result of the climate change. So we are actually experiencing the effects of these climate changes in Zimbabwe. So there is a drought currently. And, with drought comes economic challenges. So this has severely compromised people's access to basic services such as health, water, sanitation, hygiene. And it has also increased vulnerability to our communities to infectious diseases. So recently we had an outbreak of cholera in most of our cities here in Zimbabwe. And also, at least 4 million vulnerable Zimbabweans are facing challenges accessing primary health care. People also struggle to have access to primary health care, including people living with HIV. And then 1.2 million school-age children are actually facing severe challenges accessing education. Some parents actually cannot afford to send their children to school. We also have challenges accessing sexual and reproductive health care for our people. It's a major concern. And we have actually a high maternal mortality rate, which at the present moment stands at 651 per 100,000 live births, which is very high and way above, the average of most low-income countries. And our other pressing needs, with the combination of the climatic and economic challenges, women and girls are more vulnerable, they are more at risk of gender-based violence. We've actually seen an increase in early child marriages in our communities because maybe out of desperation, some parents, they sell off their children because of the poverty. We are also, like every other community that I heard yesterday, dealing with issues of drug and substance abuse, high unemployment rates, and poverty. And one of the previous speakers yesterday highlighted that there's a relationship between poverty and mental illness. So I think that's actually one of the research topics we should do. Like, is there a correlation, between poverty and mental illness? And it's also good to talk about our strengths, community strengths and assets for us here in Zimbabwe. I think one of our greatest strengths is our human capital. So Zimbabwe is one of the highest literacy rates in Africa, which according to the Zimbabwe National Statistics Agency stood at 93.7 in 2022. So most of our people here in Zimbabwe can actually read and write. They're literate. And we also have millions of college and university graduates. I believe this is an asset because they can be used as research assistants. They may need supervision from senior researchers, but our graduates can actually be used as research assistant to collect data, which is very vital for our interventions because we want them to be informed by research. And also, according to Zimbabwe's Ministry of Higher and Tertiary Education, approximately 30,000 students graduate annually here in Zimbabwe from the country's institutions of higher tertiary. So, this is actually a very good thing. I think our graduates can actually be an asset and a strength. And one of our assets also here in Zimbabwe, we are a very religious country. So there's a church in every community. So it's very easy to carry out mental health campaigns by mobilizing the churches, which is actually one of the things that I do. I do a lot of raising awareness in the churches. You find that it's easy for the pastor to mobilize his congregants. So there's still a lot of stigma surrounding mental health issues, especially in religious circles. So having a church in every community is actually an asset. It's easy then to demystify mental health and dispel some of the myths surrounding mental health. And in terms of interventions, I was very excited yesterday to hear people talking about decolonizing psychology. And I believe this is very profound. We definitely need Afrocentric approaches here in Africa, which tap into our indigenous knowledge and that are culture sensitive. So psychosocial interventions, community-based interventions. It's also important. I'm glad that we have, different stakeholders from different disciplines. We definitely need a multidisciplinary approach to the issues that are affecting our communities here in Africa. And I was also very happy to hear everyone saying we definitely need to establish collaborations in terms of research, and also that we also would need support here in Zimbabwe in terms of funding for our research. And finally, I just want to say, as ZPA, our desire is to continue taking up spaces and positioning psychology to lead from the front, especially when it comes to bringing solutions and interventions in our communities. So once again, thank you so much to the SCRA team for bringing us together. Thank you.
Thank you, Pamela.
Thank you very much, Pam. Okay, you can go ahead. Moshood is fine. Go ahead.
Thank you, Fungai. Thank you, Pamela. Yes, taking up space. Your last statement was the key. Our elders, our people back home always said, you cannot find your way if you don't lose your way. It's a very deeper emphasis that we place on a lot of things that we do, especially around decoloniality. We cannot follow the West method of decolonizing things. We have to kind of embroider ourselves in our own decoloniality process, and that is taking up space. And that's what we're doing here, using the master's tool to do what we need to do in that sense. So I appreciate and I applaud you. And I'm wonderfully surprised when I started researching Africa, and one of them is Zimbabwe, and your literacy level, it's amazing. I cannot speak enough. I mean, which is why I kind of joined force with you guys. And the thing I've learned from meeting all of you is I can't even I can't put it into words. So thank you, and thank you always for your leadership in Zimbabwe Psychological Association as their head. We'll move on. I'm sure there'll be questions for you, for others later, but we'll move on because of time. Happy to introduce our next speaker, someone that I've been in consultation with in the recent time. We're writing a book together about a book chapter together about sort of how to practice, sort of how to do clinical practice in a repressive society, in a multicultural society in that sense. My dear Oluwaseun Jegede, I see your message, but the point is, what are you working on currently? What is keeping you up at night? Tell people about your expertise or where you're coming from. Are you there, Seun?
Okay. Should I say greetings to everyone? I'm a Yoruba girl, so if I would greet you in my mother tongue, it is Ekason. Okay, I'm so sorry I can't on my video at the moment. So engagement with mental health and psychosocial support, I would say. I'm a professional counselor and mental health in Nigeria, and currently I'm in Germany. I studied social work across Europe through a mobility program to learn about social work policy, what social work is all about. As we know, this social work of a thing is not that developed in Africa. I can say of Nigeria in particular. We have social work association in Nigeria. So it is coming up. We have some universities that are offering these courses at bachelor's level. But like when someone was speaking the other time, she spoke about poverty somewhat correlating with mental health. So sometimes as a clinician in Nigeria, when I was working with people, I discovered social problems were really correlating with mental well-being, and people sometimes it's difficult to separate these things. And this is why these professions also should be like emphasized also. But of course, we also know that it's difficult for them to really work because the support is not there. However, we should keep developing our professionals because sometimes we get help and we know what to do and how to go about it. Lagos, for example, in Nigeria, they are really doing well in the area of social work at the moment. I can't say of other countries in Africa. Okay, so also I try to always reach out of Nigeria, out of Africa. And so I am a mentor. I'm a member of American Psychological Association, also a member of American Counseling Association. And yeah, I tried to join these associations. For American Psychological Association, I joined as a scholar program. So I won this award where I was mentored by different psychologists in the field. And from there, I started joining conferences, listening to a lot of case studies and everything. And so currently, I conducted a study, but it was focused on some European countries on domestic violence. And when I submitted my thesis, my supervisor was really interested about what is happening in Nigeria when it comes to social domestic violence. So we also try to check, and we discovered that domestic violence is a phenomenon, actually. It's a global issue, but when it comes to culture, sometimes we have some differences, of course, but culture also exists everywhere. As we know, culture is a way of people. But what we discovered was the resources again. When there are domestic violence cases in Europe, we have women's shelter, crisis center. We have a lot of resources to help the women, to empower them, to take the children out of the family if it is not safe enough, and to provide some support so that the child at least can still receive help. At the moment, I work in a residential home with children taken out of family by government. And sometimes I look at the case in Nigeria. Do we have this kind of thing, residential homes? Of course, we have them in form of orphanages, but not enough, yeah? So we come back again to resources, poverty, and at the moment, again, personal study, aside from what I'm doing with Dr. Moshood on mental health of Africans professionals, I'm also working on, I'm trying to study suicide among men, but this is focused in Nigeria anyways. So I'm also looking at this also. What is happening? Why is it that our men, they just get so depressed and before you know, gone, suicide. So we need to check. I would say an hypothesis will already be focusing on poverty maybe, but of course, until I check and get the result of what is really happening. But I would say that in any way, whether we know that poverty is a bit prevalent, we as professionals, and that is why I really, I'm so happy about this program, because the last of it I joined was from African Youth Chapter. That was when I was still really engaged with working with young people in Nigeria. And when I saw this, I was like, okay, now that my work is a bit diverse and not only young people, I now work with different group of people. Maybe this will be a good place to talk with professionals in the field, how we can increase the sanity of our people and how we can increase their resilience in managing issues and all. So I would say I'm so happy to be part of this movement, and thank you.
Thank you, Sharon. There's a lot of substance in different areas of your work. So we will come back. We would hopefully people have questions for you to engage you deeply in what you're saying. I already see Fungi is talking about collaborating on suicide among men on the continent, something we rarely talk about. Importantly so, that needs to be said. So let's move to the next speaker. Hopefully people have enough questions at the end for everyone. Is Erica here? No, not yet.
No, but I think I see Dominique around. I see her. So isn't Dawn? Dawn is supposed to go next.
Yeah, but Don is not here. This is Dominic Thomas.
Oh, okay.
Yeah.
Dr. Palmer can go.
Yes.
Dr. Jerry, Dr. Jerry Palmer is my Dr. Jerry, are you able to go next?
You know what? Yeah, I can go that, but you know what? Let me continue to come to the space to listen right now and learn. But I certainly will share a little later on. Shoot, that is won't be a problem.
Okay.
Okay. Cool.
Lorette, who else do we have a speaker for today?
We can if Dr. Erica is not here, Dawn is not here, and
Hello.
Dr.
Hello.
Palmer is not here, we can
Hello.
proceed to the breakout rooms.
I think Fungi is trying to say something.
Okay. Fungi.
Yes, I don't know if our time allows, because yesterday we were supposed to have Barbara speaking, but unfortunately she didn't have connectivity. So if you need someone to fill in the gap, I'm sure she still has a presentation in case you have the time. I know she was supposed to speak yesterday. I don't know, but she's available today. Thank you.
We can have Dr. Barbara go next if she can tie that up in 10 minutes so we can move to the breakout room. If she can tie that in 10 minutes, we are happy to ask her to have the floor.
Thank you very much. I am Dr. Barbara Selumbu. I am a clinical psychologist by profession. I run Solace Mental Health Clinic, and we also run hospital prisons and care ministries. With hospital prisons and care ministries, we go to the prisons and do group counseling to the inmates, and we also help with reintegration and rehabilitation. We also go into the community and do drug awareness campaigns. We have realized that drugs contribute a lot to crime, and we are trying to catch them when they are not yet in prison. And also, one of the factors that is fueling a lot of crime and drug abuse is for poverty, lack of jobs, and people have gone to school, they've got nothing to do. And basically, that's what we are doing. Thank you very much.
Thank you, Barbara and Dr. Barbara. So we have close to 3 different speakers that are missing today, or that are not here yet. Hopefully they're still going to join us. So if in the interim of time, so we don't just stay here, if we want to move into the breakout, just to occupy time, are we okay to do that? Yes, Sarah.
I was thinking maybe if there were questions for the 3 speakers that we had, we would have those before the breakout.
I'm hoping, because let's go into the breakout. The reason being, there's supposed to be some kind of overall collection of everything that is said when we're discussing the question. In that sense. So I think a breakout will be good for now. Jedriga, are you able to put us into different breakout, please?
Yep, I'm doing it right now. So for the first breakout room, it's going to be with TT doing gender equity and empowerment policy. The second breakout room is going to be with Latifa. I'm sorry if I'm butchering that. And they are going to be doing education and AI. And then the third room is Oluwasiun. Again, my apologies, as someone with a hard name, I know. And she's going to be doing mental health equity. So what I'm doing right now is assigning those 3 people to the rooms. And then Mashoud, if you want to put in there or in the chat what those are too. So you should be able to choose your rooms. Did it work?
Can people see the rooms? Yeah, the breakout is open.
Okay, yeah, so choose which room you want to go into.
I don't see a room. Did the window come up and pop up?
There is a window saying
it's
breakout room.
Jerry, did you get it now?
No. Is it popping up automatically, or do I need to do something else?
It's
Join a breakout. Do I need to? Oh, I see them 1, 2, and 3 now. Perfect.
Yes.
Okay, got it. And does it matter which one?
One.
Yes, Dr. Palmer, we want you to be in the mental health and health equity room. Yes.
Okay, which one is that?
That's the third room.
That's 3.
Yes.
Okay,
Yes,
got
that's
it.
the third room.
Perfect. Okay.
Thank you.
Yep.
Dr. Moshood,
Mm-hmm.
people are not going into rooms yet.
Because we can't see anything from here. Yeah.
Really?
So
Just now, I can
if
see
you
it
look
now.
at
It wasn't there before.
if you look at your Zoom, under it, there's different caption. There's a where you say recording, summary.
Okay. You can see, I can see
Yeah,
now.
there are 3 dots under there. So if you click on the 3 dots, yes,
okay.
you will. Yes, I
You
guess
see-
that's it, right?
Mhm.
Can you see it now?
Yes,
Break-
I can see the listed.
Is the
So
breakout room? Yeah.
The third one is
Okay.
Yeah, the breakout. The first one is gender equity. Second is education and AI. Third is mental health
Yeah,
and health equity.
Can you reward it, Jadwiga? Is it possible to reward it and put each of the room instead of just putting room 1, room 2? Can you name it? Is it possible?
Let me fiddle around with it.
Okay. Thank you.
But I do have it in the chat and I'll repost that.
Okay. Okay.
And how many? We didn't tell them how many minutes.
I'll probably, I think I can visit each room and just,
Yeah, we have just 20 minutes and we can come back to plenary.
And
Okay.
I'll broadcast it. So
Okay.
maybe in 15 minutes at 8:50 my time, 10:50 your time, I'll send out a broadcast for 5 more minutes and then 1 more minute and close it down at
Absolutely.
10:55.
That works. Thank you, sis.
Absolutely. Dr. Mingo is here.
Yeah, I see her.
You came.
She came. She made it.
Hello.
Dr. Me.
Hello.
Hello, are people able to get into the breakout rooms? Because I'm not able to get into mine.
100%.
Why don't you go to the 3 dots where you have more?
I did. I think it might be the device I'm using. Maybe it's not allowing me.
Really?
Yeah, it's the phone. I'm using the phone, so maybe it's because I did go onto the dots and I was trying
I
to go
can
into.
manually assign you if you have a preference for which room you want to go
Yeah,
into.
the mental health one,
Okay.
right?
That's 3.
Wow, everyone is mental health.
Hello.
Probably that was. Hi, Dr. Erika. Good to see you.
Sorry, I'm helping my husband's show, Earn Your Liberation. They're getting ready to do a live event in Baltimore. And as an event planner, I had to step in and help. And their show finished. I was scheduled to talk to them and get the people in Baltimore, everything. It's going to be, so I had to have that conversation and there was no way to do it. Once you get everybody in one space, I had to pounce. So I can't hear you, madam, you're muted. Your mic is muted, Loretta. Your mic is muted, Loretta. Does she hear me?
She can, I don't think she can. Loretta, your mic, unmute yourself.
Oh, I'm sorry. I was just chatting with Titi now, and we have more people in room 3. We have over 13 people in room 3. Apparently, that's where the major issue is: mental health issues and poverty. Everyone is there. So, interesting.
Yeah, the
Really
only people in room 1 or 2 are the people who are running.
Hey, Yadviga.
Oh, hello, my friend. Oh, here, I'll turn on.
Loretta, do you want to?
I'm turning my thing back off to eat lunch, breakfast.
Oh, look, I have the same plant behind me.
Do you want
Dr. Moshood.
to race to room 3?
You do. Ooh, it's pretty.
I race to room 3 and do what?
Coordinate with them over there because if you feel like the young lady is shaking, she's new to this.
No, Dr. Palmer is there.
Yeah.
Tissy, why don't we all just join room 3 and yes.
Okay.
Let's just
I'll stay in here to answer questions or direct people.
Yeah, please could you assign me to room 3 so I could just join?
What are we supposed to be doing right now?
Right now,
actually, okay,
because
go
we're
ahead.
waiting for you, and you didn't show up because we're doing the good stuff.
What's in room 2?
What?
Room 2. I see just 2 people in room 2. Who is in room 2?
Fun Guy and Latifa.
Oh, AI and
Yeah, we're going to break out Erica so people can just have close conversation.
I think I'll join group 2. See ya.
Because we had to do that because a couple of the speakers were not here yet, so we had to kind of break into the breakout. So they'll come back in 20 minutes. If you want to join any of the room, Erica, or if you want to stay and chat with me.
I'll stay and chat with you because I'm trying to figure out, like, I was talking to Loretta a little bit yesterday about what I might be able to contribute to such a space. And I'm always careful not to kind of do the most. I don't want to like try to turn it where it doesn't want to go or something, but you know my mouth. So I'm trying to just honor the intention here, but also make sure that I talked to Loretta. She's like, yes, you are in the right space. We do want to hear the Pan-African perspective because the smaller issues to me seem like part of the bigger problem. And my best space for work is the bigger approach. And the smaller on the ground stuff, I'm too ignorant for because I don't have the local experience. I mean, ignorant is not a bad word. It's just a fact. You know, I just don't know enough to have any real input. What I look like telling people how to handle health problems in a country I've never been to.
I don't even think it's to tell them. I think it's just to compare notes. What are we doing here? You're African descendant in that sense, right? What are you doing here that can complement what they're doing out there? What are they doing out there that you heard that can complement what you're doing here? So since you don't know anything on it, since you said you're ignorant of what is happening on the ground, and when they're saying it, how does it resonate? What does it ignite in you in that sense? You know, that's what we are hoping to accomplish. But there's nothing wrong when you start now, because what we wanted you to do was to talk about that fire that you always bring, in the sense of this is you guys are talking about this stuff and this stuff in this way, but I'm talking about the Pan-Africanism of the bigger picture in that sense. Now, will it scare people away? I don't know. I don't care. We're here. People need to hear what they need to hear, but romance it or say it in a way that, you know, capture what they said. Yes, and you were here yesterday. Capture some of what they said yesterday, and how you see it going into the future. I think it's what I think people will love to hear in that sense.
Okay, beautiful, and I'm happy to do it because I will have to share something and then break away because Fridays I usually have the baby. So I wasn't aware this trip, but I'm definitely going to try because look, Mashoud, first of all, seeing this is so exciting to me. And I'm so grateful for all of the stuff that you're doing here and with Loretta too, because you know my position. Like, and what I was sharing with Loretta is like this thing, I mean, Black people across continent and across diaspora, it's the only thing that's going to solve or fix or anything. And so all of our individual pocket issues, I realize that there's short-term, long-term goals, local and expanded goals. And I tend to work long-term expanded in my thinking. But I realize that long-term expanded goals have short-term work that starts right now, but short-term steps towards a longer expanded goal looks very different than short-term steps for a short-term local goal.
For sure.
And I'm wondering if there's like an opportunity for affinity groups, because like you have like on the table, the menu was mental health or this or that. And if a kind of long-term Pan-African play. Like I was really wishing that I had gotten engaged with this sooner, because I would love for there to be somebody represented from the Congo, because there's like some serious stuff going on there right now that can contribute. And so I just want to be a part of a god dog. Like I was telling Loretta yesterday, I think the connection between Kwame Nkrumah and John Henry Clark is my favorite version of Pan-Africanism. And that's what I want. That's what I want for here. I want people in the States and the Caribbean, Shania, all of us to come together and say, what are the assets of our region? How do we begin to build bridges that are separate and apart from the bridges that are built for us by the hegemony and white domination? How do we build our own bridges to one another? And it seems like on par with what you want, and letting somebody has to hold the bridge for other people to walk on. So it sounds like a lot of people in this call are bridge walkers to do the actual work to and then others are maybe like bridge builders. Yeah.
Say it to them like that too. Let them know that this is how you feel, like this is the work that they're doing in terms of the analogy of the bridge. But there's a need for a bigger play that needs to take place, we can't keep saying we want to do health work without understanding that there's a policy over our head that we don't even control at all. We can't even get into that circle if we're not careful. But there's something to be said about holding space like this, because it calls people to question, to understand that there's more to do in that. When we broke SCRA, well, at least when I tried to break SCRA into different regions, there are some people here from Eastern Africa, right? What I told them to find colleagues in different regions that is close, in their close access or annex in that sense, in terms of regional neighbor. So Fungi was supposed to look for somebody in Congo, in Southern Africa, in Tanzania, people that are close to them. But it's not easy having people just come to this. A lot of people are dealing with many. What you're saying about Congo is a whole different beast that we don't even know where to begin right now. And Congo is I don't want to dismiss the mightiness of the craziness in Congo, because what is happening in Sudan also needs to be talked about.
That's right.
Okay.
That's right. All of it.
What is happening in Libya? I'm studying Libya back and forth right now. I'm going to APA talk about trafficking of of organ of migrants at the next APA. It's unbelievable that we are witnessing that, how we're slaving people away at this time. So, maybe they need to hear it in that frame of, this is the small part that what we're doing is just to bring this bridge together, but there's a bigger force at play over our head. And it seems like we can shake it, and we need to be aware that it's there. Maybe that's what people need to hear from you.
I think so, because we don't like to think about the kind of deep primal problem, because the problem's not even necessarily policy, unless it's the policy of anti-Blackness.
It's not a mistake.
Sorry, I'm here listening and eating, and yeah,
that's okay. I know. I mean, you.
Oh, you're good. You're good.
We done talked about this stuff before.
We're not trying to we're not trying to overtake the US. No, don't worry.
No, I don't care. I say, let me tell you something. Yeah, Viga ought to know by now. I say this no matter who's in the room. This ain't nothing I'm trying to hide under a blanket. I'll say it to the president. I'll say it to anybody. I mean, these are facts. These are realities. I'm not making this up. Anybody with eyes can see. Yeah. These issues are of, and feel free to share. Yeah, Viga, you don't have to just not say nothing.
Well, but thinking of, I mean, I've listened to this idea of this African-centric, right? When everything is so Eurocentric. Here, I'll turn my things on and stop shoving food in my face. And not having this whole last 2 days, right? It has been experts from Africa or descended from Africa talking about what's to be done and not using the Eurocentric, framework for it. And that's the start of it. That, this decolonization is I saw a quote about it, right? It's not adding BIPOC folk as decor. It is completely dissembling what is happening. And part of that is not using this Eurocentric modality of how we treat, biopsychosocial issues. It's always Eurocentric. And so I see that, and I hear you saying, Erica, that you're not from Africa, but you are, those things.
Oh, I'm African and I'm from Africa. What I was only saying was I know Africa, and I know Africa better than a lot of Africans sometimes, just as a lot of Africans know the South Side better than a lot of South Side people, because I'm willing to look at it from a critical lens. I'm very clear on what I know. What I'm just saying is that in terms of whatever the mental health crisis is on the ground, picture me trying to say to somebody about their local issue, this is what needs to happen. Even if I have an opinion, and I do, I'm not going to put myself in the space to tell someone that, because it doesn't help with the relationship building that's necessary in order to build the fabric among Black people that is essential. And the beautiful part about what's happening here, I mean, I know you're here taking notes, and I'm glad you are. I know your mind. But it's Black people talking about what to do with Black people for Black people. And that is what a lot of Black people have been so indoctrinated to feel scared about, because it's too Black. And their personal white people may not like something that's too Black. And it feels like, oh, well, if you excluding white people, then what's the thing? What's going to happen? How are they going to feel? We've been taught to nursemaid white people for so damn long that we can't even get into a room and have a conversation with one another without thinking about the perceptions of our personal white people in the back of our minds. What they gonna think when I get back to work? What they gonna think if I found out I was at this thing that was too Black, right? And so it's very difficult to try to shape people, because there are colonial consequences. They come
historical traumatic consequences
for being too Black, for thinking about yourself. I mean, my mother is afraid for me. Let's just put it that way. My mother is afraid for me and my mouth. She might have a good reason. I don't know. I don't feel like I'm that right.
No, you'll be. You just stay north of the Mason-Dixon line.
Right. So we got to think through ways to open up our people, give permission to let it be Black, and understand the kinship and eternity that is necessary for the healing of our people based on the trauma and horrors that have happened at the hand of Arab and European influences. And I've unfortunately had to start adding that first layer, which I wasn't going to add for many years to come. But the recent conflict has forced my hand, because that's what is the reality. And if we don't start dealing with reality, then our children are going to inherit these same horrors. And that's why I don't have time for half steps and half measures, which is why, Mashoud, I'm grateful for you to say, yes, Erica, you are free to say it all and go forth, because without that, I don't know how to be a part of these sorts of actions.
And you shouldn't have to self-edit in order to participate in these spaces.
I never do.
No, I know that's I don't think
any editing I do is purely out of respect for what Mashoud is trying to build here. And girl, I told you I wasn't coming to this meeting. Why are you? Let me just tell her.
Let me broadcast. You guys have broadcast message. Oh, you can broadcast your voice.
Broadcast your voice.
Let some of the professionals also know that sometimes we use coloniality and decoloniality as a catchphrase. It's just redundancy. It doesn't do the work. So people are open and saying because they are doing coloniality work, they are doing the work. And I've seen enough people doing nonsense, saying they are doing anything decoloniality. I've established when we started today that our older folks said we should lose our way together. That's the only way we can find it. But somebody has to be the torchbearer. No one is willing to be the torchbearer. People are willing to do the work comfortably in their zones, whatever their zones are. So we need somebody constantly to kind of, they're going to hate you. Some people will hate you. Like that I can tell you for sure, coming out of this. But since when do we care about people hating us so we can do what we need to do? So do what you need to do or do what you must do in that sense.
Great. And I shall. What is my time frame and when do I do it? And then I will also have to scoot away after so that I can get to the baby.
When people come back, when they come back, I don't know if we want to do sort of what's the recap of what they said in the breakout. I don't know what that's going to take. So I can nip it in the bud to be 10 minutes, and then you can go maybe another 20 minutes to talk.
Okay, I won't talk for 20. I don't know what I'll say. I always think 20 minutes always sounds long until I look up and it's been an hour. But I will.
How do you want me to introduce you?
Whatever comes out of your mouth.
The troublemaker in our village is here to talk. Is that what I should say?
Whatever comes out of your mouth is fine by me. And we'll just do it organic like we always do. And I will, I'm gonna say I'll give myself, what time is it? What time do they come back from the breakout?
2 minutes.
2 minutes. Okay. So I'm gonna give myself to 11:30. If I have to push it to 11:45 on the call.
Okay, that we should be square with that. I mean,
yeah, but don't rush anybody on my account.
When they come back, I'm just going to say who's going to give a recap of each of the rooms, and when they give a recap, if I sum it up and then I move it on to you. Okay. Yeah.
But I am interested. Anybody, I just want to make it plain. Anybody that is interested in the Pan-African element and this part of the work, I'm happy to collaborate. And I don't know, like, because Loretta was talking about meeting again in 4 months, and I was wondering if there might be affinity group meetings in between.
You can certainly put that on the table too, but I think people are just too caught up in the work they are doing that I don't know. But hey, there's nothing wrong with the proposition. Like, you think the future of such engagement should be some kind of affinity group, you can propose that.
Okay.
And let's hear what people say. But I know for a fact that many of people here are too caught up in what they are doing, and maybe even be a new thing for them. I meet some of them on every Friday for this group that we talk about, and they're basically just talking about mental health. What do we do? How do we do it? What are we practicing? So I can imagine, because of their busy mind, it will be a new orientation for them. Certainly, we can say we can guide them into the process, but again, if we don't say it, maybe they wouldn't know that it's something that needs to be done.
And those engagements can happen online, via email, via
sure.
Slack groups and stuff like that.
For sure.
Okay.
People are trickling back. So
you guys just cut us off when Dr. Palmer was telling us something very interesting. Please, can she continue?
That's okay. That's okay. Yeah, it'll come back. But yeah, it was just your word that we want to focus on or center is wellness, right? That's absolutely different from the absence of disease. That's not a comprehensive way we want to address social issues like the ones we've been talking about, right? We want to address it from mental wellness, and you were speaking about. And so that encompasses everything from spirituality to socioeconomic. It has a wider or broader lens than simply thinking through let's just get people well or into recovery. And so we can talk a little further about that at some point.
Welcome back to everyone.
We miss you.
I was intellectualizing here with Dr. Erica Mingo, and I'm sure she's going to shoot me for saying doctor, but
make it worse and call her professor.
Okay. What we want to do is sort of, what is maybe one or two people give a recap of, because I know there was 3 rooms and one of them got broken down. So maybe there's a recap of each of the room. Who wants to give that so we can know what was said in the room and so we can compare in that sense? And I think Dr. Palmer already started that conversation when you guys came back. So Jerry, do you want to continue, or you want me to move to someone else that can give a recap of what was said in the room?
I think it would be helpful, to hear from others in terms of recap. Loretta was one of them, certainly. When you're sharing something, we want to hear the lens of others that really kind of heard it, or, how does the message or the conversation resonate with those that were in the space. So I think that would be helpful.
Okay. Anyone from room 2 or room 3?
Yeah, I'll go first. So hi everyone, my name is Latifa. We were actually in the breakout.
We're
Yeah,
struggling to hear you. We can hear you, Latifa was training. Was training to hear you.
Is it better now?
It's better now.
Absolutely.
Oh, sorry. So we were so it was a mix of TT, myself, and Fungi. So we kind of just put together AI, gender-based violence, and education. My work is actually on self-diagnosis. So I'm actually looking at the impact of AI and the internet on exacerbating mental health conditions through self-diagnosis. But now we have to kind of deviate in terms of like indigenous community psychology practices, and we're actually looking at the context of AI and education in itself. And one of the things that we raised in that group was that how do we leverage on addressing misinformation with regards to our indigenous psychological practices when it comes to using information from AI as a tool and educate our people? How do we ensure that people who have limited access to technology or limited access to internet don't just find an opportunity to, get information and then be like, oh, I have this information. Remember, information is not knowledge, because you can find everything on the internet and you might not even know which one to use and which one not to use. I think Titi also came in from the angle of how do we ensure that the people who don't have this access, how do we ensure that they are well trained, so that when like they have things that kind of bothers them, they know how to address such issues. So I think I also talked on mitigating the risk of adopting the use of AI in our community psychology practices, because when we look at when the internet came around, the arrival of the internet was in 1983. And you will have thought that the internet came like a long time ago, but it was just 1983. And then we started seeing that the internet was used by almost like 2 million people in 1992 for even just health-based information. People were going to the internet to see, oh, do I have cancer? Am I pregnant? Am I this or am I that? And then a lot of people just see those symptoms and it's just like those symptoms are like they are being mimicked. And you just feel like, oh, am I pregnant? Even just to the point of getting pregnant, people begin to search like, oh, I think I missed my period, doesn't mean that I'm pregnant. They go to Google and they just ask Dr. Google. So compared to what we have seen with the advent of COVID, and now we've seen proliferation of online information with regards to mental health education online. And then people just go there and to find out like, what's wrong with me? You see people come in and say, oh, I think I have depression. I saw a lady talking about it on TikTok. And you know what? I'm depressed or I have ADHD. And we're seeing all of these things happening. So in terms of our communities, how do we ensure that our communities are not misinformed when it comes to using the internet or using AI for getting information that is actually relevant to them? We talked about ensuring that people are not being misinformed or they are not being disinformed or they don't just have access to or they just lack quality information. So we talked from the area. Finally, I think we also talked on having like a fact-checking tool that is relevant to our community, such that even if people are using this type of AI tools to get information on education, our communities should have their own network where you can easily plug in those type of information and say, you know what, is this true? Give me the source of this type of information for our communities. Thank you very much.
Just to add to what Latifa said, one very important thing we discussed from Fungi raised how our intervention should be modeled around indigenous knowledge. So people that are in the grassroots that live with these people have the indigenous knowledge and have to be involved in participatory research. So that's one very important aspect Fungi brought. Thank you.
Thank you, Titi. Thank you, Latifa. Yeah. Anyone from the other room?
Okay. I was hoping we'll have almost everyone from because the breakout room had the third breakout room had mostly everyone, almost all participants, about 15 people. So I was hoping somebody will jump in from that group. But if there is no one from that group, I want to thank everyone for who is gonna jump in?
I can comment on a thought that Dr. Palmer shared, which I think is really pertinent to this conversation. And correct me if I have the paraphrase incorrect, but she mentioned something around the idea of the description of the problem. And I'm not sure, Dr. Jerry, if you could speak to that a little bit, because I think that's really important. But if I just may add to what go ahead. I see you're muted.
Yeah, sure. You know what? Yeah. So basically, when we're thinking about social issues and the concerns that we're talking about, and they all are definitely, at the top and the center of focus. But one of the things that I try to go back to, even in constructing lessons or constructing topics and work that we're doing in the classroom is and importantly in a community psychology framework, is identifying the problem. And so when we do that, the way that you frame a problem is going to determine how you attempt to solve it or the resolution of it. And so I think that's what is being shared on the floor right now. And that's important. And that revolves around looking at it from a collective, I think, viewpoint versus an individual viewpoint, and has a number of other components or pieces to it. But importantly, if we're thinking about a model, then I think that's important to include the original or the initiation of how do we frame the issues that we're talking about. So I hope that's helpful.
Great. Yeah, no, it really is. And I'm glad you spoke more on that, because I think that's important for us to really hone in on, and that idea of language and definition. I mentioned yesterday that I founded an organization called the Coalition for the Advancement of Nigerian Mental Health. And the idea is more collaboration between what's going on in Nigeria and also, in the diaspora. And really, I think we had to kind of go back to the basics, right? Because within ourselves, what I realize is we use a lot of language, the terminologies, mental health or mental illness and all of these things. And it sounds very elementary, but we had to ask a question. What is mental health to the African? What is mental health to the Nigerian? Because we even thinking about the idea of the generational gap. This is That's right. Very new concept to a lot of us who grew up in the diaspora or moved here. So whenever there's a tension between what's happening with the older people, like, what are you guys talking about? What's mental health? The younger people are also fighting back, but we don't realize that really we're just misunderstanding one another. Mental health, if I were to probably Google, would be a more recent language. So even defining that, and I had to Google the other day because we were even trying to look for other words, in terms of going out to do street interviews, to really understand what people understand by this. But even that, we were like, we can't just use the word mental health. We have to find other ways of communicating this idea, because to the Hausa people, which is a tribe in Nigeria, mental health means someone with madness. So they're not thinking of this gradients that Dr. Jerry Palmer mentioned of, going from mental wellness to mental illness. They're not looking at it from that perspective. So I think there is a huge language barrier and misunderstanding going on, which we need to define. And even from there, and I think to what Ms. Oluwaseun said, what is the barriers to accessing some of these, services? I will just be blunt from my perspective and, just what I've seen in the community. Mental health is not relevant, understandable, or accessible to a lot of people. They will not come into a room. We don't do that. We don't pay for mental health. I don't recommend mental health or therapy to a lot of people because it is costly. You're asking people to pay $200 for, again, people that they don't know, people that don't understand their background. So I think there's a lot of mismatch here, both with language, both with what people are looking for. And I think someone just also said, you know, the application, part of relevance is what are people dealing with? We can't just copy and paste a lot of the phenomenons that we, you know, have in the diaspora and say, oh, let me just diagnose you and this is what you're experiencing.
Mm-hmm.
A lot of Nigerians might know of a doctor, I think he's called Apricot Doctor or so. And, you know, you'll see a lot of the content that he makes. The reason he's so popular is because he can just tell Nigerians straight up, like, a lot of you guys drink malts. This thing, you know, let's compare the sugar and actually see. That's what people resonate with. You're not talking about ginger ale, which I don't think we drink, maybe now we do, but we're not talking about messages that that's foreign to people. So I think a lot of this too is a huge knowledge gap. Before we start talking about interventions, we need to be speaking the same language.
So yeah, I just want to piggyback just a bit on that, because I do, one of the things that I do bring to the table are those type of workshops and professional development, and have done it in a number of venues, is a workshop called Language is Never Neutral, right? It's always saying something. And so, yeah, right. When we think about the way culture processes all types of language, right? So that's one thing we have to be really cognizant of that in terms of, you know, how we're, before we get to an intervention, absolutely. And that's what I was speaking about the foundation of a model has to have a place to start. That's one of the things. And the other one is, when we think about psychology or just general psychology in the diaspora, we're thinking about it from a white-centered lens, for one thing. And that is critical that we remove that lens. And when you hear me talk about that, moving forward, that lens, that's one of the spaces that we know is detrimental, because it does not encompass the many ways that culture sees mental illness, all of those things. And so, yeah, importantly, I'm glad that that was brought up and that we can expand on.
Thank you, Dr. Palmer. Dr. Iwowari, you said you've been raising your hands and no one has seen you. Please, if you can, go ahead. Then afterwards, Victor can go ahead. Yeah. Okay,
don't worry. Go ahead.
Yeah, okay. Thank you very much. I'm excited to be amongst you. I was invited by a friend to participate in this discussion. I want to say thank you very much, because it is germane that we talk about mental health, especially in Africa, especially also in Nigeria. I am an energy psychologist. I don't know how many of you know about energy psychology, but before I came into energy psychology, I studied managerial psychology. That is the psychology of dealing with managers and helping them to overcome their limitations in order to move forward in terms of performance in their various organizations. When I got into this, I come across post-traumatic stress disorder, because I saw that a lot of managers were manifesting PTSD and they didn't know about it. And my research said that PTSD has no cure. However, when I got into energy psychology, I realized that yes, it can be cured, but the approach is different. So I use energy psychology. I studied energy psychology and energy medicine, which I promote in Nigeria as energy therapy. I have a position around mental health, and I'm happy that Damilola Kolade mentioned something about defining mental health. How do we take it to the people, especially in the North? She made reference, not only in the North, in the East, also in the West. When you talk about mental health, that come to people's mind immediately, and that also brings the issue of stigma. Now, my approach has always been, and I'm very serious about it, to recommending the decoupling of psychiatric health from emotional health, because there are so many aspects of emotional health challenges that are lumped together with mental health, with psychiatric health to give mental health, which do not require psychiatric intervention. So we need to, when we do the decoupling of emotional health from psychiatric health within the mental health substructure, people will be open to going for help, seeking for help when they are emotionally disturbed. A lot of people in Nigeria are emotionally disturbed, but they don't want to access help because they will be classified as people with mental health. So the definition needs to come around this decoupling, and the intellectual group need to work around this to find a way to have this decoupling so that emphasis will be more on emotional health than on the psychiatric health, which is the mental health that people know about. So before it gets to psychiatric health, I know unresolved emotional health can lead to psychiatric health. But if there is early intervention in terms of emotional health intervention, it will not lead to psychiatric health. So there will be no reason for people to begin to run away from accessing help because what is bothering them is emotional in nature and not psychiatric. So when we do this, it will help us to get around all this issue of stigma, indigenous language, because there is no language that does not have emotion in it, because it is a feeling and everybody feels. When you tell somebody if you feel bad about something and that feeling is persistent, look for help. It is easy to communicate that than to say when you have mental health, look for help. It doesn't fit. And this is because in the DSM categorization of mental health issues, which came very, very late in the classification of mental health challenges, there's so many things were lumped together. Some of those categorizations were even done by people who didn't understand the nitty-gritties of mental health. So we lump anger, we lump fear, we lump everything, we lump psychosis, everything into mental health. And that is not helping the development of the body of knowledge that we now call mental health knowledge. So that is one of my, that's what I think that is limiting activities within this area in terms of the level of success that we want to achieve. Thank you very much.
Thank you, Dr. James. That was a lot. But one good news that I got to give you out of that is that with my work with APA and UN, I know some people are working on trying to recategorize everything that is spring together into the DSM-5. So, I mean, it's early in the process. I'm aware of it because of my work. So I can tell you that is coming. I don't know how soon that will be, but that is something that definitely needs to be done, as you rightfully said. I think Victor has his hand up, and I also saw someone else, Dominic was also, Mr. Victor, go ahead.
All right, good evening, everyone. So like yesterday, during our discussion, we made mention of this issue about people thinking about madness the moment you talk about mental health. So with this understanding, when we started our mental health programs, trauma specifically, we have that understanding that people may not want to come because they just feel that, oh, these people will think that something is wrong with me. So using this Afrocentric approach, we just carved out a name for that particular section. And what we target was the discussion, my future and I. And then we have a lot of people coming for that program. And so before we go into any mental health talk, we just have to do some kind of background on trauma issues. And then we make it an open mic session. And so far, it has been super interesting. It's an open mic session where everybody comes to talk about their emotions. I mean, sometimes it's very tense, but I mean, it's been working for us. Just this week, I did an article about this Afrocentric approach to solving our problems, because over the years we've relied so much on donor funding, and donor fundings come with specific instructions, and they are not meeting our needs, especially here in Nigeria. A lot of money have been spent on projects, and we are not seeing success stories. So when we begin to talk about Afrocentric approach yesterday, I mean, I was super happy because this has been my own way, of thinking, like Damilola said. I mean, you have to look at the people. Even if I want to do a trauma program, like I said, the name we give it, I'll look at the people and see, okay, how do I present this to them that will be accepted? We're supposed to do a program in the North some times ago on visioning. And the anchor person said, Victor, you can't do a visioning program in the North. They will tell you that you want to come and disciple them because we actually don't believe in the future. And so we will have to rephrase that program to suit what will be acceptable to them. So this Afrocentric approach is very, very important in everything that we do. Like we all know that the first priority of trauma is to, how do they call it? The first aim of trauma is to change the priority of the mind. And so we have a lot of people whose priority of the mind has been changed, by the circumstances that surround their life. And so to reach out to them, we have to, like we used to say, come down to their level, come down in a way that they will really understand what we're talking about. Yesterday, Dr. Alphonse talked about, entrepreneurship and mental health. I mean, for us, that is the stage that we are now. Our entrepreneurship program is starting with mental health program. In fact, we had a meeting recently and we told them, if you can't accommodate a trauma program into your entrepreneurship program, then we're sorry, we cannot, because you are likely not going to get success stories, because these people, they are coming from a background with a lot of baggages. And if you don't clear those baggages off their mind, there is nothing whatsoever that you are going to be doing to them that will be effective. They will come for your program. Probably you want to give them some stipends or you want to give them some starter pack. They will collect all of these things, but they will sell it off. And so this Afrocentric approaches is what, I mean, this is my take home here. I mean, this is what I've been working on, but I mean, coming again from everybody now, I mean, I'm going to work more on it. If you want to have, way forward, this is something that we have to do. Finally, yesterday we talked about, there's this style, this system they do in UK. I'm sure they do it in other places where during summer, you have professionals coming to Africa, to lend their hands to problems like we discussed like this. I mean, can we use this forum, to also practice things like that? Dr. Alphonse talked about some issues in South Africa. The other madam talked about Zimbabwe, Malawi. I happen to have some friends, some online friends that I'm mentoring, both mental health and on entrepreneurship in Malawi. And they tell me most of the problems that they have. Now we can do what we are trying to do through labor migration, skill mobility. I mean, mental health practitioners, they are experts. We can do this skill mobility across the Africa. If we are good in a particular program, we can actually come to Malawi and then give out our expertise to the people of Malawi, do a kind of train the trainer, and then they can continue that program. The people that are good in the area we are lacking in Nigeria, they can also come to Nigeria, train people in Nigeria for them to continue this program. I think with this, we will be able to cover much ground. You recall that yesterday, I said the challenges we have, I consider it a strength. The challenges is that there are not many places to go for mental health, but the strength is that we have many people that want to be trained to offer these programs. So how do we leverage on that? Thank you very much.
Thank you, Mr. Victor. Yeah, that was beautifully said. Dominic?
Hello, everyone. My name is Dominic Thomas. I'm here in Decatur, Georgia. I'm currently a visiting assistant professor at Morehouse College in the psychology department. And I just wanted to essentially reiterate and co-sign everything that was just said, especially as it relates to language and the importance of language. In my critical thinking class, I spent a week on language to show just how language can be a political instrument and a way of both switching power relations and also creating those same power relations, because any people's language is their way of explaining and maneuvering through reality. It's like James Baldwin said, the language is a political instrument. And I keep driving that point home every semester to my students during this week, because the way in which we think about the language we speak is the way in which we think about our representations of reality. And I tie this to quote unquote Ebonics. And what is Ebonics? People think it's quote unquote broken English, but no, it's West African grammatical structures that are being used by African diasporic people, but we are now just using quote unquote English words. But then the English language in and of itself is younger than most of the grammatical structures that we are using. And the script that is English isn't even indigenous to quote unquote England. The actual Latin script is derived from hieroglyphics. The letter A is an ox turned upside down and abstractified. So just showing the ways in which even how you understand the development of language can be a way of understanding the development of a people and the development of history. And the words that we use to tell our experiences influence how we understand them. So when we take these words that are in the mental health field, well, what is even mental health? Once you start breaking down what each of these individual words mean and where they come from and the cosmologies that underlie each of these terms, you start to see why they don't work. They come from entirely different cosmological systems of understanding the universe. So if we operate from our indigenous perspectives in a more unified space in which there's no hard separation between mind, body, and soul, then the idea of mental health being something totally disparate that you have to go out and pay for makes no sense. But if you come from a cosmology that, say, this Descartes French mind-body dualism, in which they're looked at as two different substances possibly, you start to see how mental health becomes divorced from physical health, and people start to take one less seriously, especially if you have a more materialist view of the world in which you only focus on what's quote unquote observable. So the things that are, sir, do you have a book, links to articles? I don't have a book that I've written, but I can give you lists. Yeah, the history of psychology is also missing. And this is something that I realized when I took it as a graduate student is, wow, all the philosophical assumptions that are underlying Western psychology and how that definitely doesn't work with anything that we were doing on the continent. Like quoting like Aristotle being one of the starting points of Western psychology, but where did Aristotle and these Greek philosophers actually get a lot of their knowledge? They got their knowledge from Africa and the other areas of the world as well too, but we don't get taught that. So we don't get taught the languages and the histories of the languages, and we also even don't get taught the proper development of these philosophies that are supposedly only European. We don't know that these Greek philosophers were also going to Egypt to study under the Egyptians and to get knowledge from them that they could take back to Greece. Why do you think Socrates was executed? He was bringing in foreign influences.
That's right, Dom.
Dominic. That was beautifully said, Dominic. Thank you for breathing that into the space. You know, unfortunately, from where I sit, the problem then is the consumption of these things by our people, you know, because people just take it and run with it. For all I care, people have been using decolonize since we got here. But what is decolonize anyway? What are we decolonizing in this space or in other spaces for that matter? So thank you for bringing that on board. Because we can't keep borrowing language and use it to fight other people's fight. We need to use our own. People that know me very well what I do, the way I do what I do. I don't, you know, I speak from, in fact, during my PhD, I had to make a whole fight. I don't want to consume this, what people are giving me here. And I went out of my way to look for African scholar that can feed my soul, you know. I see Modupe hands up and I see Charles, and we're going to end with those two so we can have the next speaker speak. Ms.
Okay. Okay, good evening, everyone. Okay, just to add to what Mr. Victor said, You know, I totally agreed with everything. And this is the second time I'm going to have somebody that really believe in that view. That, see, this is a damaged, here is a damaged human being. Probably, let's say a trafficked human being. A woman that has been trafficked, has gone through a lot, is traumatized, falling into depression and all that. And then we come up with beautiful, beautiful, you know, assuming or assumed programs of entrepreneurship, empowerment, and all that. And I kept saying, look, the foundation is not there anymore. What happened to these people while they were being trafficked? I dealt with the mind, the soul, and the spirit. And until that foundation is put back to place through probably going for therapy and the rest of it, you have nothing as a foundation to build anything on. It's just a complete waste of time. And I'm so happy that Mr. Victor rightly said it, that there can never be any success whatsoever when you start to do entrepreneurship for people. You assume that you are helping them. Their mind is not there. And then the next moment you say, we've been helping them, empowering them, and then you will just hear the news that they have jumped over the ocean and they are dead. And you keep wondering, after all, we have empowered them. It goes beyond that. We have to really find a way to touch their souls. I don't know how we are going to, people have been doing it anyway, and I know that is the most important thing. Let's deal with that trauma. Let's deal with that, with those things, you know, that is keeping them up to not sleeping. Let's remove all kind of stigma. Let's speak out. Let's encourage people to speak out about their conditions, and let's make sure, as we said, that we don't make them feel that they have mental illness. That is just the way to go. You cannot build on the foundations, the damaged foundation. Thank you very much for allowing me to speak.
Thank you, Ms. Modukwe. Dr. Charles? Dr. Charles, are you there? Okay. If Dr. Charles is not there, well, it's my pleasure to have the next speaker come up, my dear sister, that, you know, when I started my PhD program, this person looked at me and said, dude, you are one of the few African that's going to pass through this stage. Are you here to just do the next thing and just move on? You know, I've been challenged by this person for the longest time. And I admire
Dr. Charles is saying he's trying to unmute. If you can unmute him.
I don't have the Jadwiga.
Sorry for cutting your short.
No, he should be able to unmute.
Okay.
Let's see. Yeah, it won't let me unmute you. It will just let me ask you to unmute yourself.
He should just touch the screen. The mic will come out and he will touch the mic and he will unmute it.
Pending when Dr. Charles is able to figure out, let's just power on for now. So what I'm hearing in this space is, regardless of the language or what we call things as they are, and some of them have different reasons why they take ownership of our body, our places. There's a larger force at play that I think when we started talking about with the team, Loretta and Fungi and Dr. Saragon, we didn't intend it to be, this space is going to end up being strictly talk about mental health. You know, it just forces itself into the space because we understand there's a whole different ball at play here. And one of them is what Dominic beautifully spoke to. You know, we can't keep borrowing people's language to do our own bidding. We can't keep, we have a different epistemology, the way of being, the way of everything we know to be. But because we keep repeating the same thing that has been taught to us. And the funny thing is, I think it was Karen Beret that said, the master's tool at some point will even fail the master. It will, the promiscuity of the tool, of these tools, even disgrace the masters themselves sometimes, right? But if we keep using the tools that is disgracing the masters, isn't that a problem for us? That's following blindly, right? So in this case, should we continue down this line? We're going to come back here again and again and again and talk about this thing in this way. But there's a need for recalibration. You know, many of these things are not working. I've been in nonprofit here for over 2 decades. And we keep spending billions of dollars over and over on the same thing, calling the same thing, because again, we can't think outside of the box. We've built a cage around our mental state, you know. So it's forcing us to keep doing the same thing over and over again. If you want to know, all you have to do is just read about Haiti. Haiti was the first republic. They shouldn't be having the problem they're having now. Haiti is back at it again. Congo, the richest continent by mineral in the world, is back to crisis again, right? It's because we keep using these tools that's been built for us, right? So the point of this place is, how can we rethink? And I think Erica has this way of framing these things that, you know, sometimes, you know, if you're not found well-grounded, you might get offended, but she means well, I think, right? So let's hear from our next, my dear sister, Erica Mingo.
Thank you. I think I do mean well, but I often offend. And I don't even try not to, because the world offends me. Almost every element of it. I'm offended by the poverty, the hunger. I'm offended by what's happening to my people in the continent. So if I am to be offended, let's all be offended, is my theory and philosophy. But I don't set out to offend anybody here, because this is such a lovely space and I'm grateful to be a part of it. I want to say that I'm grateful for the words and everything that I've heard from everyone, but where's the name? Dr. Dom just really struck one with me just now, because I mean, you know, language is so ever important. The first thing that I wrote in my notes and everything you said, I mean, like I'm totally looking you up, like as soon as I get off this call, and I'm going to find everything you ever wrote anywhere and I'm going to read it.
For context, Erica, you're talking about Dr. James, right?
Dr. James, yes.
You won't worry. You won't worry.
Yeah.
Okay.
So talking about language is so important, and that's come up a couple of times. And we've even been in our own language here on this call using the term indigenous knowledge or you know, indigenous CP practice. And a good place to start, if we are to be African-centered, is to actually center African people in ways of processing and thinking. And so what we're doing is community psychology. And what others are doing is Western community psychology or European community psychology. But we're doing is the community psychology. And that's how one centers themselves. That's how African practice, African ideas, Black stuff for Black people, or just for the world, is centered. I mean, if other folks can name the very stars and the months of the year, surely we can center our own practice as the practice, and then other people's practices. So why not, instead of indigenous community psychology practice, this is community psychology practice. And then
girl, I'm on
okay, and then what we've been taught is Western psychology practice. And so that's one big one that I think is important. And then so that leads me to think about, someone raised the question, I think it was one of the students from National Louis, I know I just met her. Atifa said, what is mental health to the African? And I thought that was a really, really great question. But the real bigger, another question in addition to that is, what is mental health to the colonized? What is mental health to the enslaved? Right? What could mental health possibly be? What is health in a sick world? And when you have a group of people who've gone about the business of enslaving and murdering and stealing and robbing and other and worse. I'll use more sensitive language because of the group. What is mental healthness? What is mental health and mental health wellness in that space? Is it even possible? Right? And when we think about what mental health is and trying to find solutions to that, and what are the prescriptions and what are the ways that we can get around it, one of the only ways around that to me seems to be activism out of that condition. Because to try to be well in a sick world is an impossible task. To try to be healthy and happy and content in a disgusting and degenerate environment is in itself pathological. And so it seems that at the very least, alongside the attempts to be mentally stable and well in a sick and insane world, part of the first steps would be activism towards the resolution and the healing of the environment that you're in alongside. That's absolutely right. I see somebody naming Frantz Fanon because my ideology and my ideas come out of African scholars. I'm a student of Cheikh Anta Diop. I'm a student of Frantz Fanon. I'm a student of Kwame Nkrumah, Patrice Lumumba. I'm a student of Steve Biko, And so and I'm a student of the interconnection that they've had with Dr. John Henry Clark and Malcolm X and others here in the United States during a very important time in the African continent of decolonization. But it was decolonization and it was thwarted and pushed back by all of the external influences that would leave us in this condition and oppress and indoctrinate us so much so that we, as we think about our problems, it's like being in a burning house and concerning that the bed's not made. Before we could even consider the bed and the cleanliness of the house, we have to put out the fire. And so when I think about who we are and what we face in terms of colonialism, particularly as we look at the mental health challenges that come from healthy and old people living under new neophyte, really horrifying and ridiculous conditions. The mental health crisis of the African at home and abroad is based in the colonialism that we've endured and suffered. And it's not just colonialism in its old manifestations, is as it exists today. There's slavery on the continent today, as what Mashoud was alluding to. There's that are happening abroad constantly, and the what we endure, what we are facing, started a long time. It started with Arab nationalism, hegemony, and exploitation, followed by white nationalism, hegemony, and exploitation. And we're not even allowed to say these terms. We're not even allowed to look at it dead in its face for what it is and say, here's the people that oppress us still. Here's what's happening in the Congo. There's a separate country that has come in and landed on top of those people and got them digging minerals out of the earth for our phones and laptops. And we want to sit and talk about just the small aspects of it. We have to talk about the larger aspect of it. What can we do to solve for that larger aspect and umbrella everything else we're talking about under that? And the only solution is Pan-Africanism, as far as I'm concerned. These are just my ideas. That's what Loretta and Mashoud get for asking me to come here, right? So Pan-Africanism is the only play. Because the reality is that African people for too long, it's like gym class. I don't know how gym class works in other countries, but in gym class in the United States, there wasn't no uniform. We had our basic gym uniform. When we split into teams, they had to give us these raggedy little smocks to put on. And one smock would be red if you were on the red team. The other smock would be green if you were on the green team. And that was your identity for gym class, red or blue or green. And that's essentially what has happened to the African at home and abroad. We've been given smocks by the oppressor. We've been given smocks by colonialism. And we run around swearing that we are a green smock. We may as well say it when we talk about ourselves in terms of the nations and the identities that have been handed to us on top of our ancestors' identity, on top of our ancestors' lineages, on top of our culture and our own understandings of the world. And we're running around claiming and repping sets for smocks and names and places that we didn't even create. I would argue that we take off those smocks. The smock that says Jamaica, the smock that says the United States, the smock that says whatever country, And that's not to downgrade the culture and the practices of those local persons, but those practices and those cultures and those rich traditions ain't got nothing to do with the colonial label that you were given. And so I say, shackle ourselves from those colonial labels and begin to work with one another towards freedom and liberation for African people. And then and only then can we have conversations about mental health. Then and only then can we have conversations about what's next for our micro problems. And somebody said in the chat, we cannot have global solutions for local problems. I would argue the opposite. There are only global solutions for local problems. There is only Pan-African solutions for local problems. And we need only look to other nations and people to determine how that plays out. We need only look to how other people in other diasporas, people in the diasporas for countries that didn't even exist at the beginning of my mother's life, and how people in the diaspora from those countries feed into and protect the identity and culture of those spaces for the reverberating protections of themselves worldwide. Indeed, only global solutions for local problems. And if we can begin in this space with all of these Black people on this call, with all of these Black people, and I say Black people with intention, because sometimes when you say Africans, we get confused, like I'm not Africa's daughter. Even though my people came from Macomb, Mississippi, I promise you I'm Africa's daughter. And nobody can take that from me. You can't colonize it away from me. You can't molest it away from me. My hair and skin betray anybody's definition of who I am. And so all of us, the world over, absolutely must fabric ourselves together, sew ourselves together in a Pan-African play to push back on the hegemony that has landed on us and has kept us enslaved psychologically. That's our Bobby E. Wright said, menticide is our biggest psychological problem. The systematic hegemonic destruction of the Black mind. All of the things that are at play in the separate spaces, but what's going on in Nigeria, what's going on in Congo, what's going on in Mississippi, what's going on in Atlanta, those are distractions. The largest problem overall is anti-Blackness. And that anti-Blackness is very, very old, and Black people of the diaspora must begin to reimagine what our future looks like. And then and only then will we have success thinking about all of our sub-problems. We cannot make it in a burning house. And so I'm a psychologist just like everybody else here. I understand the impacts of mental health. I understand the impacts of our community level problems. But I would argue that if we don't create a Pan-African umbrella under which to operate our activism in the short term to offer relief to our people that need it desperately now, today, if we don't umbrella that with a Pan-Africanist perspective and an ideology that understands and does not run from the impacts of colonialism, then and only then are we going to be able to really, really have change. Otherwise, to Mashu's point, you're going to be spending billions of dollars on the same thing year after year, because the goal was never to solve the refugee crisis. It was to manage it. End oppression is to manage it. The goal is never to end poverty, it's to keep it. If we don't stop managing our problems and work to win unapologetically and unafraid, why are we worried about offending people who enslaved us? Why are we worried about offending or upsetting people who have done such dramatic, horrible things to us and continue to this day? Unless we unshake ourselves from the yoke of that, remove that level of fear, work all of our projects underneath the Pan-African perspective, I fear that we will continue to be unsuccessful. And it is truly my great honor to be here with so many people who want to do this work. And no matter what level, no matter where you are, no matter what corner of this, everybody's role is useful and beneficial. Everything that I've heard on this call today is so very important, so deeply beneficial. I don't hope to stop anybody's work. I it a Pan-African perspective so that we have a better shot at success. And I appreciate you all letting me soapbox here for a moment. And I'm gonna end it there. And I thank you all for listening to my bit. And I hope that if there are others that are interested in a Pan-African umbrella, that we might be able to form an affinity group and work together to begin to think through the processes and these ideas we all have, and this benevolent, beautiful love for humanity that we are all sharing. Hopefully we can work together, those who are interested in the Pan-Africanist approach. Thank you so much.
Thank you, Erica. This is something we can all think together and sort of formulate with time. How might we, engage in such, at least how might people here engage in such affinity group? I mean, I know it doesn't have to be physical. It doesn't have to be in space. We can start it right here. We can do it online. We can start it as a process here. So I promise you that you should be looking at your email and see if people are going to respond to the proposition that we need to form some kind of affinity group, Erica. And I'm sure you're more than ready to take ownership of that. So thank you for that. Before I go to, I think, who's supposed to be our last speaker, Dr. Jerry Palmer. Charles, are you okay? Are you able to kind of ask your question now?
Can you hear me?
Yes, we can hear you.
Okay.
Dr. Charles,
okay.
before you proceed, can you hold on? Dr. James, Dr. Iwuwori, can you please mute your mic, please? Thank you, sir. I appreciate that. Dr. Charles, please go ahead.
Okay. First of all, I want to say a little bit about who I am and what I'm doing, and the approach that I and the organization that I work with, that I founded, in fact, takes. And the website is on the chat. We take a very grassroots approach and a very Rogerian approach. So in other words, what we do, and I see a number of people in this room with whom I've worked over the past couple of years. I've been doing this work since 1988. I also come from a migrant family, highly traumatized family, by the way. Grew up in the States, so I'm aware of a lot of the issues that people have brought up. Lived in Holland, again, a place where there's huge amounts of racism and huge amounts of traumatization and huge numbers of migrants. I live in a town, an 8,000-year-old town called Vukovar in Croatia, which was one of the first battles of the war. And when I got here in 1995, there was virtually no building that didn't have a bomb hole in it. And it's an ethnically divided town. Still. And the point I'm making is that that we have to train people. There is not enough capacity. We must be training people in villages. We must be training people and empowering people to work for themselves and for one another. Some of the, once we get it, they don't have to have university training. They don't even have to have high school training. What they need to have is a feeling for people. And people solve their own problems. People will empower one another at that local level. And in fact, online. We have a number of groups in Africa right now. We've been working with Victor and those people for a while. We have a group in Malawi. We have two groups in Malawi. Now I stand corrected. We're working with people in Congo. We're working with some Ukrainians, et cetera, et cetera. The point is that people have to share their experience, get their emotions out, work over long periods of time, and help one another. And this also avoids the stigma. Because if I'm talking to my neighbor, if I'm talking to somebody downtown or who lives somewhere around here, then I'm not talking to a psychologist. And I'm not talking to somebody who can put me down. And I'm having a conversation. I'm not having a therapy session. Of course, I am having a therapy session, but I'm not being stigmatized by that therapy. And the purpose that we all have to work for is to empower those people. And that really, I've seen it, as I said, I've been doing this since 1988. I've seen that that approach works. So we really need to be able to form groups and work with those groups. And by the way, my email is in the chat. If anybody wants to form groups, we do it as a couple of people here know, free of charge. We do it once a week for an hour or two, and we also do individual work. And believe it or not, the approach really does work.
Okay, Dr. Charles, because of time, I thank you. I appreciate the information because we have less than, if we're going to stay to our time, we have less than 7 minutes, and I would still love to hear from my dear auntie, Dr. Jerry Palmer.
Thanks, everyone, for being on this call today and yesterday. I think it is critical. I absolutely am on the same page with, I think, every aspect, every thought, right, that we have really generated today, and all of them, as Erica shared, I think, takes us to the place that it takes us to a beginning. This is certainly a beginning, and Mushood and all the other organizers, I think Loretta and others who generously pulled everyone together. It is the beginning of something I think can really grow into a monument. They can really be impactful around the issues that we all have this commonality on, right? Whether we are here on Turtle Island or whether we are on the continent, these issues are really the same, and we should look at it from that space. So that brings me to, as I have was in the breakout room and heard yesterday, the magnitude of issues such as drought and climate change, and from that environmental justice perspective, from the perspective of I'd like to say dealing with mental health, moving into a mental wellness space. That brings me to, there were three primary thoughts that came up for me. One of them is, I think that Dr. Mingo has a great point that should not be dismissed. Pan-Africanism at one point in history was an ideal. I think that today we should really seriously consider moving from an ideal to a movement, whatever that might look like. Because the ideal can be easily dismissed, as which it was historically to some degree dismissed, although it stays in the hearts and minds of those that think of it as a space where we can get traction. I have another colleague who calls it Pan-Africanism. She doesn't call it Pan-Africanism. She calls it Code Black. And I think, though it has some of the right, Mushood is nodding his head, but it has absolutely some of the same, or the same principles that when we think about it, when we think about Pan-Africanism. So those of you who are not familiar with that movement, or the ideals that'll move us to a movement, then that's a place that I think would be helpful to start putting our hands around. And it does not have to stay in the what I want to say, it can evolve, right? Movements should evolve. And so let's think about how we can evolve that movement, and certainly not let this be the last time that we come together to share ideals, or share, I would say more than ideals, to share what we should call a new ideology, right? A platform that we can begin to move and liberate and do the things that need to be done. So falling under this collective identity, I'll say it like that, that's huge. And what that might look like. So falling under that, what comes to mind, number one, I'm always going to think from a foundational level before, again, we move into other spaces like intervention. And that foundational level is going to come back to reframing the language that we use. That's flexible, but the underlying point about that is if we are speaking language that continues to bring individuals into deficit spaces, or if we're speaking language that does not lift up, does not liberate, and its language is the language of white supremacy, the language of the colonizer, we really need to be consciously thinking about reframing it and using language that uplifts, using language that builds up, and moving away from all types of language that diminishes rather than liberates. And so to that end, we have people in the space that even if we want to start and come back together with workshops and forums that focus on what words and language are we talking about, that should be at the top of our agenda. Because if we speak the language, because we know we're talking about the dismantling of languages, particularly on Turtle Island, particularly in the diaspora, that is no longer being used. And the more we go, the more erasure, cultural erasure is evident. So I think that that's critical, that we began to develop a language we use and really focus on it. For example, again, I'll go back to homelessness. You will typically, or you shouldn't ever hear me call people homeless people. And why? Because I believe that if we use people first language in certain spaces, my philosophy is how we see people determines how we treat them. And to that end, that's just a small example. And then thirdly, what came up for me is, of course, I spoke about this in the small group, the breakout rooms, is framing the definition of the issues we are attempting to confront. Dr. Mingo, Dr. Thomas, and a few of us have brought this into the space. When we look at the issues we're attempting to confront, they are always, always, always under the umbrella of the possessive investment in whiteness. This is critical for us to understand that, because when we do, we see social issues differently. We make yes, Funge, reframing terms, it is essential. So what I'm sharing here in this little time left that we have is just that we need a foundation before we move out into the magnitude of issues. They are monumental. They are necessary to confront, but we must have a foundation to begin with, something to stand on that this work is predicated on. Those are some of the things that come to my mind as I've heard the attendees here share, that we can begin with and to keep this movement going until it's like a spark at this point. We want to turn it into an inferno, and you do that by continuing to poke the embers, by continuing to put fuel on the flames, and by continuing to take these bits and pieces where I've heard such great pieces that can be this foundation, and I want to kind of leave us with coming back together to make sure we put fuel on the fire. So thank you.
Thank you, Dr. Palmer. That was beautifully said. If I was going to wrap it up, I'll tell you, within the role of Loretta and Fungi and Terragon, Loretta representing, at least for SCRA, Loretta representing West Africa in that sense, so all of the countries in West Africa, and then Fungi representing Southern Africa, Sister Saragon, Eastern Africa. Within that space, there's a little budget that we can use to push this further if we need to, right? So if whoever is interested in some kind of engagement should reach out to these people, Fungi, Loretta, or Sister Saragon, respect perspective of this region that I just mentioned, there's a lot of work to be done, this community work, and the best way we can do, and I don't even want us to use people's time without compensating them. So that's why we have some little budget that Loretta and Fungi and Sister Saragon can distribute when the time comes. So to keep this work going in the way you said it, I think, we can back it up with that from our hand here. And that's sort of where we're thinking of building relationship in that sense. This place is always open. When I say this place, I mean our role within SCRA, within APA, is always open. You can use us here as resources as much as we are open to use everyone at home as resources to figure out what is happening and how to kind of carry across in the global space. And I will stop there, having appreciate everything that was said in this space. And I don't even know where to begin now because you've all said so much that I need to go and think about in that sense. Loretta, do you have some sort of closing